doing right now manual therapy and stretch for the Adductor Magnus muscle. I picked the Adductor Magnus because it's the biggest one. I forgot them all. I just remembered the word Magnus and assumed that trumped all the other ones. Okay, so Adductor Magnus attaches from the ischial tuberosity, the sit bone, runs down the posterior aspect of the thigh, which is the linea aspera. It even attaches a little bit onto the medial epicondyle of the femur. Now, to do the manual therapy over this, we're going to do a gliding motion. Patient's going to be wearing shorts. I mean, obviously you're wearing jeans, so you're not going to get, you'll only be able to do pin and stretch. But patients show up sometimes in jeans, you've got to work with it. Okay, so what we're doing here is I'm getting the patient in a position where I can access everything, okay? Women are okay. Guys, stuff falls over the side of that, okay? So what we got to do here is we got to be careful, right? So what we're doing here, but sometimes we have to take that all the way to the ischial tuberosity with this. Okay, so this is pretty good. This is pretty good exposure. It's big muscle, so we can do a lot. It's big. I don't care, guys. If you guys want to use a little bit of elbow and work all the way up, you can do it. All the way up. Good. And the officer tell the guys, they go, hey guys, look, just get the family jewels, pull them aside. Just tell them that, and they just do. It's just the way it is. Okay? So we're going to take this origin to insertion, or insertion to origin. It's a big muscle, it's wide, there's a lot to cover with that. And whenever we get in, we're not going to do it right now, but we can get into fine areas. You'll see a lot of people, they get problems right at origin insertion. They'll show you. I mean, they're going to go, doc, it's like, it's right here. You got to work with it. That's what you got to do. Okay, and if that's the case, then pull the jewels aside, and you can get in there with the thumb. That's what you do. You go to the thumb, you ride the skin all the way. You'll feel it bump right in the ischial tuberosity. You know you've hit maximum, you've hit the end of the muscle. Now, it stretches the muscle. Pretty easy stretch. Go to supine for me. Adductor Magnus is easy. You can really focus on, there's a little bit of flexion, there's not much. If we pull this thing to straight abduction, we're going to hit most of the muscle. And you know what we'll do? We'll stretch this side here. Okay. Pretty easy here, guys. I've got my hand, I'm stabilizing this side of the pelvis. Keep in mind, whenever you're stabilizing too, you want all your fingers equal distribution. Picture this hand, you want all your weight distributed equally, because you do a point, you're going to zap them with it. You're going to feel equal distribution, I have a little bit of flexion, and keeping the toe pointed up. How you doing right there? And yours are lousy, right? Yeah. Inflexible. Okay? And so we'll just hold the stretch right here. And we can always anchor a foot too. Look, he can create his own anchor right there. I just hold this down a little bit. It's a little less work for me if they create their own anchor. Put that out. Guys, I'll tell you what works too. Give people a shake when they stretch. The shake that's why you shake babies. Put them to sleep.